papers on this. Here's one, Journal of Autoimmunity 2016, Risk Factors in Autism, Thinking Outside the Brain. Immune system dysfunction in this wordogram comes to the very top of this. How is the immune system and the brain linked? How are they linked? It turns out our immune system has 4 major components to it. Cells, like white blood cells. Antibodies, you know about antibodies through COVID. Cytokines are small protein signals, and cytokines for sure penetrate the brain, big time. And then lastly, complement. You won't hear much about complement, but complement's the final attack sequence on an organism, a pathogen. But I can tell you cytokines, which are circulating in the body, and there are hundreds, if not thousands of them, are the communication signals between white blood cells and parenchymal cells, tissue cells, heart cells, brain cells, kidney cells. The cytokines, you can imagine, go wild when a baby receives a vaccine. And for sure when a baby receives 16 vaccines at once. It has to. And when these cytokines rage in the human body, they are responsible for fever. They are responsible for changes in the child's affect. They're responsible for pain. And for sure, they are responsible for febrile seizures, for sure. So cytokines must play an enormously important role in the genesis of what we're talking about. This paper by De Los Angelos, Robinson, Agramonte, I love how the people from South America just load up the names. You can actually find her entire lineage in that name. But this review, just in summary, is exhaustive. It has 236 references. It was published they did a search in 2023 in PubMed. They found 200 papers that the immune system is involved in the development of autism. For sure. For sure. This is not conjecture. So something is disturbing the immune system, the cytokines go into the brain, and they do cause changes in the brain. Immune system dysfunction is on the storyboard for the development of autism. I don't think doctors 80 years ago were thinking about the immune system, although they may have, and I'll show you a case example. Febrile seizures. Febrile seizures for sure occur in children and result in neurologic damage. This is very important. Here's a paper by Gilberg. And in Europe, they have a definition called ESSENCE. ESSENCE includes tics, seizures, motor disorders, autism spectrum disorder. So it's a grouping, attention deficit disorder. That's called the ESSENCE disorders. There is a significant association between febrile seizures and the development of autism. If a child develops a febrile seizure of any cause, because a febrile seizure is due to cytokines going in the brain. Well, what could cause a febrile seizure? Influenza could, strep throat could, an ear infection could, a gastroenteritis could. About 3 to 4% of children per year have a febrile seizure. So febrile seizures are part of this. Parents may observe them, you may not. The baby may be in the bassinet and you may not know. A febrile seizure could lead, if you don't witness it, could lead to sudden infant death. And then finding the baby dead in the crib. But febrile seizures, when Tracy first asked me, I said, I want to lecture on febrile seizures. It's so important because parents need to have this awareness about febrile seizures. Then I said, no. That's part of a bigger story here. But the evidence here is compelling. Do vaccines cause febrile seizures? For sure. For sure. This is a paper from our US CDC, from the public access database. For sure they do. They list these cases. they occur with combination vaccines. They can occur with single vaccines, but they're far more likely to occur with combination vaccines because the child is trying to manage multiple, either killed, live attenuated, or antigen vaccines all at once. And the cytokines are being raised in the baby's body. But for sure, vaccines cause febrile seizures. Now, the debate is how much of the 3 to 4% of febrile seizures is caused by vaccines. There's not a good source of information for that because obviously there can be other causes. But when you think about the intensity and frequency of vaccination, chances are vaccination, in terms of a population attributable risk, are a giant risk for febrile seizures in children. How many of your child had a febrile seizure? Probably about 10%. 10%. Very, very scary. This paper, very important. I quote this paper a lot. Nielsen and colleagues from Europe. When a febrile seizure occurs, there's a 41% chance the child develops one of these essence syndromes when followed over time. 41%. A tic, epilepsy, attention deficit disorder, autism. They didn't have it at birth. They got sick, they had a febrile seizure of whatever cause, and now there's a 41% chance the child neurologically is changed forever. So febrile seizures are a big teaching point. My son's an ER resident right now. I was talking to him about the other day. I said, what do you tell parents about risk of febrile seizures, and what do they do about it? He says, well, we do dual use of Tylenol and ibuprofen. He said, you better believe it. We're talking, we need fever control because the fever itself is part of the determination for the seizure, and part of it is not related mathematically to the temperature. But we need to get control over inflammation in the body of whatever cause. We would not want a child to just be rocking at 105 and have a seizure from any cause. It's going to end up, this is a very, very important study. So now you can start to do the math. 3 to 4% of the population per year of children have a febrile seizure. If they have a febrile seizure, there's a 41% chance they could end up with one of these disorders, autism being a big one. Now we're starting to get to a 1 to 2% rate of autism. Now it's starting to epidemiologically fit together. Where are we with vaccination? You probably had a lot of lectures on this. This paper was just published last month. How do vaccines, there's the word, cause autism? How can Bill Kennedy or Maggie Hassan or Bernie Sanders get up there and say, it's conclusive, the answer is in, vaccines don't cause autism, when there's papers being published saying just the opposite in the peer-reviewed literature? There must be an opportunity for discussion or debate or deliberation. There are always 2 points of view. There are always 2 points of view. Always be leery of any attorney or senator or congressman asking a question where the predicate to this is a long assertion. They are making an assertion, and then it's down to, doctor, don't you agree? Or doctor, this is yes and no. That is a method by which attorneys manipulate the witness. Senator Cassidy, Senator Hassan, and Senator Sanders were intentionally manipulating Robert F. Kennedy and Jay Bhattacharya, and I think to some degree, Marty McCree. We should never have our employees in Washington, which they are, they work for us, being manipulating witnesses in an advice and consent process. I've testified in Washington multiple times, and I've been an expert witness many, many times, including cases that have gone to Supreme Court. And I usually let that go on, the assertions go on for a long time, and say something like, Senator, this is my hearing, isn't it? Not yours, right? I'm the expert witness. I'm under oath. You're not. Something like that. They have to be reminded who is doing what. Whenever you see a long assertion, immediately think witness manipulation. But this paper says Listen, immune system dysregulation right there up front, and it summarizes historical points. One of the historical points in this whole story is back to Leo Kanner. Leo Kanner summarized in 1944, he summarized 11 children. He characterized the initial cases of autism. But case 3 was a child who had gotten the smallpox vaccine. Remember, the MMR didn't exist back then. The child had gotten the smallpox vaccine, had gotten a fever, and then had a week of GI symptoms, gastroenteritis type symptoms. So there's the GI tract connected again. And then over the next few months or a year or so, the mother, who he describes as being obsessive, keeping notes about her child, describes classic autism. So there it is, right there. Now, Kanner wasn't debunked. Kanner wasn't castigated. As far as I know, he didn't lose his license. He's just reporting what he observed. Well, that's what Andrew Wakefield did. He just reported what he observed. It's just an observation. This paper stood as a valid paper in the medical literature for over a decade. And then there was relentless pressure to have this paper retracted. Relentless from the pharmaceutical and vaccine industry. Relentless pursuit of Wakefield. He had to be destroyed by the biopharmaceutical complex. He was too credible. He was too articulate. And he was too right. The early observations, the seminal observations, are always discredited. This had to happen. You know, the very first observation of doctors washing their hands to prevent infections when they went from woman to woman doing pelvic exams, no rubber gloves back then, that was the mid-19th century, was Ignaz Semmelweis in Austria, Germany. He did a study. They started washing their hands with chlorinated lime. The infection rates plummeted. The women survived. He presented his research. He had to be wrong. He had to be discredited. All his papers had to be trashed. He had to be stripped of his professorship. He had to be stripped of his hospital privileges. Ignaz Semmelweis had to be destroyed because these doctors could not be viewed as spreading infection from women to women with their hands and resulting in death. He died in an insane asylum 20 years later. Then about 20, 25 years later, Lindner and others came along and said, you know what? Yeah, we should have been washing our hands. The initial observations are always castigated. Sir Austin Bradford Hill, 1949, presents to the Medical Research Council, smoking is a risk factor for lung cancer, convincingly. No, this can't be right. Doctors are smoking, nurses are smoking, doctors are advertising cigarettes, doctors are smoking on rounds in the operating room. They're giving out cigarettes to our soldiers. Smoking cannot cause lung cancer. Even though the smoke is black, the cancers come out, they look like they're black. In The Emperor of All Maladies, a book written by Mukherjee, it's a great read. It's one of the few books he won the Pulitzer Prize on his first book. He's a Dana-Farber hematology oncology fellow at the time. He writes about the lead surgeon at Johns Hopkins who's taking out lung cancers and smoking all the time, teaching the junior doctors. No, smoking can't cause lung cancer. And there he is smoking and pulling out these cancers. He himself dies of lung cancer and doesn't admit that lung cancer causes smoking. So 1949, the data are in. Smoking is a risk factor for lung cancer. Complete denial by the medical community. 1943, Luther Terry, Surgeon General, a real Surgeon General, carefully studies this, concludes smoking is a risk factor for lung cancer and other problems, calls all the major chiefs of medicine to Washington for a meeting. You should see that film. These chiefs of medicine, Mayo Clinic, Harvard, Yale, Duke, they are green, they are nauseating, they are sweaty. When he presents the data, said, we are dead wrong on this. We've been wrong for decades on smoking. It was a shockwave in medicine, a shockwave. And it still doesn't die out. You remember 1970, half the population smoked. People still smoked on airplanes. People smoked in the halls of Congress. It wasn't until the 1990s where we had the tobacco settlement. Here we are. This paper was published in 1998. And sure enough, look where we are now, about 25 years later. We're right on schedule for the Great Awakening. People woke up. Yeah, people woke up. People woke up about 20 years later on hand washing and smoking, and now they're waking up about 20 years later on vaccines from this seminal observation. I use the word seminal. Seminal means the discovery. See, Cantor reported it in one of 11 children, but he didn't put two and two together. He just was carefully reporting the news. Wakefield said, listen, it looks like these are related. This was the MMR vaccine in the children developing autism with some GI disturbance, lymphoid hyperplasia. He didn't say cause. People asked him later on, he said, maybe we should split them up or separate them or delay them. But no, he had to be destroyed. Do you know this week in JAMA, one of our major medical journals, it was a paper lamenting vaccine hesitancy. They went right back to Wakefield. They cite Wakefield in this paper. He's in Austin, Texas, alive and well. But this is important to know. To this day, Andrew Wakefield must be positioned as the sacrificial lamb in this entire propagandized war that we're in. Why would his name still be brought up? Then they said, oh, the debunked, the discredited Andrew Wakefield. Well, if he's that debunked and discredited, why is he continuing to be brought up in the medical literature over and over and over again? Because he made a seminal observation. That's the reason why. This paper, Gail DeLong, is one of probably a dozen or so papers that started to put it together. This has a large sample size for the time it was published in the early 1990s. The point of this paper is it wasn't really until we got to multiple combinations of vaccines. This is a survey of 30,000 households, okay? And they really had the data here. Once we got to children getting 4 doses of diphtheria, tetanus, and pertussis, 3 doses of polio, 1 dose of any measles vaccine, 3 doses of Haemophilus influenza B, and 3 doses of hepatitis B, that's when we started to see these risks really, really take off. So the DeLong paper is the one that says, listen, chances are it's not any single product or any single ingredient in any single product. It's just piling on the combinations. Now, there are plenty of papers that have tried to drill down and say, is it aluminum or is it thiomerisol? But we can't get away from the idea that there is a combination of products given all at once. And the manufacturers, just as the last presentation have said, have kind of played games with minimum concentrations of adjuvants, what have you. And remember, it's not just autism that's taking off, but it's also peanut allergies and food allergies and atopic diseases. And it raises the issue of what's in these that could be stimulating these allergies, including trace peanut oil. But it's not as if there are no papers written on this. If you said, listen, I'm concerned about aluminum in vaccines, it's not like you're pulling it out of nowhere. It's in the peer-reviewed literature. The same thing with thiomersal. There have been efforts to actually try to tabulate how much aluminum actually accrues in the body. Different story, but also great concern. There's concern about both fluoride in the water supply and, in my view, to a greater degree, aluminum in the water supply. A lot of people don't know about this. Fluoride in the water supply related to lower IQ in children when it's above certain thresholds. We've actually had an HHS toxicology meeting on that in 2016, published. But we even have better data, prospective cohort data on aluminum concentration in the water and risk of dementia later on. It comes from a large prospective cohort study in France. And if you think we have a all hands on deck kind of emergency with childhood autism, we also have an emergency with adult Alzheimer's and dementia. My dad died of dementia. I know that very well. This is the most recent paper of many, but it's worth citing. If you're going to say, well, doctor, what evidence do you have that vaccines could be a risk factor for autism? I'd say this one, Mawson and Jacob. 49,000 children who are Medicaid recipients in Florida. Huge sample size. They sample at age 9 years, and they ask the question, automated data, do they have autism or these other neurologic disorders, what the Europeans would call the essence disorders. And then they go back and see how many Medicaid visits did they have for vaccination. And Medicaid has codification for this. So they have a group that had no Medicaid visits for vaccination. This is interesting. This is pretty contemporary data. Do you know what percent of children in Florida have had no Medicaid visits for vaccination? 10%. 10%. 90% have had visits. So it's an opportunity to have a vaccinated versus unvaccinated comparison. Okay, it's an opportunity. Now, doesn't mean this unvaccinated group didn't get any shots, because they could have gone to a school vaccination campaign or vaccines in the church, and there's no Medicaid record of that. All the prior studies that people have claimed, when there's particularly from Scandinavia, that vaccines are not associated with autism, they never have a clean control group. And this doesn't have a clean control group either. But you can see there's orange and blue. I can tell you the orange are the vaccinated. So vaccines were clearly associated with the development of autism, clearly. And the more shots they took, the greater the risk of autism. So it was internally consistent. The more Medicaid visits for vaccination. This is just one of now probably a dozen of these. So when Cassidy says there's no evidence, he's completely incorrect. That we have evidence to weigh, just like I'm weighing it now. We can never allow, he's a doctor. He's a doctor. That's unacceptable to have someone like that in Washington not be fair, balanced about the data. It's never case closed. It's never science is settled. Those are incorrect statements because the data are evolving. We know certainly the vaccine schedule is evolving. When you have two things going up, the vaccine schedule is going up, autism's going up, you don't go back 20 years ago and say, oh, case closed, Institute of Medicine, case closed. No, it's an emerging story. Here's the schedule. Now, people always get this. I was born in 1962, so there were 3 shots. I got them, and it covered a total of 5 diseases. That's legit. When we get to 2024, there's confusion on the number. You've heard 72. One time I used 108. Here, this is 88. Why is there confusion? Because there's confusion on how many COVID vaccine shots are in the schedule for kids. There's confusion there about, do you get caught up? Do you not get caught up? So it's somewhere between 88 and I think 113, I think is the number, depending on how many COVID shots. This schedule just gives 1 COVID shot. So it could be higher. Now, I've said on TV, and you've heard me mention this, about this compound vaccination, and I said a child receives a battery around age 1, age 9 to 15 months. And I was accused by a pediatrician of exaggerating this, that the kids don't get this much together. So I took the schedule and I counted up every single thing a child is given during this time frame. The answer is 16. Now, they're given in combination products, so it may seem not be 16 shots, but they are getting 16 things conceivably all at the same time. Recently, Children's Health Defense reported a poor baby who was getting caught up. Did you see that case? And that was it, probably 16, and that was it. It's right around this time frame that sudden infant death syndrome occurs. 78% of this occurs within a week of a big battery. 50% occur within 48 hours. Sudden infant death syndrome is tightly temporally related to getting a big battery of vaccines. Very related. It's so related that Burl Hamady, a representative in Louisiana, pushed forward legislation that all children who die, sudden infant death syndrome, a healthy baby dies under the age of 1, that child get reviewed for when they got their vaccines at the time of autopsy, because they all have to get autopsies. Do you know that the coroners of Louisiana said, no, we don't want to see the vaccine record? Why would a doctor doing an investigation into death not want to view information? They know. They know. The reason why this whole thing is understudied, everybody, is they know. There's no reason why. Hamady was helping the coroners. He was helping the medical examiners to mandate this information come forward. They did not want to see it. In fact, they lobbied the representatives not to approve that legislation. Bury their heads in the sand in the state of Louisiana. Well, now the panel, the CDC ACIP panel, which has been suspended by Robert F. Kennedy, they added the COVID vaccines to the childhood schedule. Under emergency use authorization, no testing for teratogenicity, carcinogenicity, genotoxicity, no safety studies over any duration of time, no large prospective, double-blind, randomized, placebo-controlled trials, no medical indication, and no clinical necessity. Nothing. This was the straw that broke the camel's back. Confidence in the entire vaccine schedule is plummeting, and it's because of this. For sure. We're at about 10% of parents now walking away, saying, I've had enough. I've had enough. There's even one paper in a preclinical model where the COVID vaccines have been linked to autistic changes. Again, probably the commonality of cytokines going in the brain in animals. World Council for Health says, and this is 2023, they've seen enough. Now, this is an evidence-based, physician-led, consensus-driven organization. This is essentially like the CDC. It's just another CDC or another WHO. Look what they say. A common sense approach now is needed. If you need an organization to back you up on this in a state like California, you could use this and say, listen, they are urged to wait on all vaccines. Just wait. So some principles of vaccines is that they're much safer when they're given as individual shots and not all together. You think I've made the case there. And they're much safer when they're given later. And from a population perspective, they're probably much safer if they're not given to everyone. If they're given based upon risk when we get down to medical necessity and the clinical indication. It can't be one size fits all. As a medical doctor, I don't prescribe the same drug to every single patient in my clinic. I can't. If I gave 16 drugs to the same person at the same time, even though each individual drug would have been reasonably safe, all 16 together almost certainly are not going to be safe. The world of vaccinology essentially has gone off the rails. I think a lot of